2 o'clock. Time having arrived, it's 2 p.m. on Thursday, March 27th, 2025. We are in the Mayor Bill Carpenter Executive Boardroom on the first floor of 45 Gordon Road, Manning Tower, Brockton, Mass. 02301. This is a regular session of the Board of Commissioners. This is also a public hearing, and all are invited to attend in person or on Zoom. Also included in our agenda is the hearing of visitors. Please note that all of our board meetings are recorded. This meeting has been posted at City Hall and also on our website. We are in compliance with the 48-hour notice. I am now going to call a roll for quorum. Timothy J. Sullivan is here, the chair. Ernest Pettiford is sick and in the hospital. Janet R. Trask, member.
Here.
Carol Roberts, treasurer.
Here.
Taylor Harris, assistant treasurer, is absent. We have a quorum. We have a board of 5, 3 is a quorum. Most of our monthly meetings are held on the last Thursday of the month, unless there's a need for a special. That will be posted. Some of our members are here in person and some are on Zoom. Because of this, all of our votes will be done by a roll call. Hello. You are hereby given notice that the members of the Brockton Housing Authority are called to meet in a regular session on Thursday, March 27th, 2025, at 2 p.m. in the Mayor Bill Carpenter Executive Boardroom, Manning Tower, 45 Gordon Road, first floor, Brockton, Mass. 02301. I'm going to read off the governor's notice. COVID-19. Due to the ongoing COVID-19 pandemic and state of emergency, on March 12, 2020, Governor Baker issued an executive order temporarily suspending certain provisions of the open meeting law, General Law, Chapter 38, Section 20. Pursuant to the order, public bodies are temporarily relieved from the open meeting law's requirements that meetings be held in public places, open and physically accessible to the public, so long as measures are taken to ensure public access to the body's deliberations through adequate and alternative means. That was extended to April 1st, 2021, extended again April 1st, 2022, extended again July 1st, 2022, extended again to July 15th, 2022, extended again to March 31st, 2023 by Governor Baker, extended to March 31st, 2025 by Governor Haley, and also extended again to June 30th, 2027 by Governor Haley, which just recently. This meeting/hearing of the Brockton Housing Authority will be held in person at the location provided on this notice. Members of the public are welcome to attend this in-person meeting. Please note that while an option for remote attendance and/or participation is being provided as a courtesy to the public, the meeting/hearing will not be suspended or terminated if technological problems interrupt the virtual broadcast unless otherwise required by law. Members of the public with particular interest in any specific item on the agenda should make plans for in-person versus virtual attendance accordingly. The public is invited to view and/or listen to the meeting via phone, computer, laptop, or tablet. To do so, download the Zoom Cloud Meeting app in any app store or at www.zoom.us. At 2 p.m. on March 27, 2025, click on and join the meeting and enter ID number 890-5023-1527, passcode 161585, or use the link http://zoom.us/i/890-5023-1527. You may also join by calling conference line at 1-646-558-8656 at 2 p.m. on March 27, 2025, and enter the meeting ID 890-50-231-527, passcode 161585, followed by the pound sign. The board chair will instruct participants on the appropriate time and manner for public comment during this meeting. If you could all please rise, remove your hats, and silence your phones for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Item 1, roll call, Mr. Tebow.
Commissioner Trask,
Here.
Commissioner Roberts,
Here.
Mr. Chairman,
Here. Item 2. Approval of the minutes of the special meeting of February 28, 2025, Exhibit A in the packet. Mr. Tebow.
I have reviewed the minutes and I have found them to be in order. I would recommend that they be approved as written.
So moved.
We need a-
Second.
A motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Kraft. Motion is to approve the minutes of the special meeting of February 28, 2025, as written. Any discussion or questions on the motion? Or comments? Hearing none. Roll call, Mr. Tebow.
Commissioner Trask,
Yes.
Commissioner Roberts.
Yes.
Mr. Chairman,
Yes. Motion carries. Unanimous. Item 3, hearing of visitors. Any member of the public is invited to speak before the board. Visitors wishing to be heard must sign in with name, address, and contact number before the start of the meeting. Each visitor will be allowed 3 minutes to speak on each subject. The board will take any issues under advisement and respond at a later date. Total time for hearing of visitors will be limited to 15 minutes, which will be strictly enforced. There will be no passing your 3 minutes to another. All visitors can be heard on agenda items only. Is there any hearing of visitors?
no one has signed in, Mr. Chairman.
Anybody on the board a hearing of visitors? Is that telephone?
Yes,
Hearing none. Item 4, correspondence. Mr. Tebow,
there is no correspondence this month, Mr. Chairman.
you're gonna make it easy.
It's a short agenda, but we have big things to talk about.
Item 5,
Yes.
approval of the bills of the regular meeting of March 27, 2025, Exhibit B in your packets. Commissioner Roberts.
Yes, I have reviewed the bills with Mr. Tebow, found everything in order, and I make a motion to accept the bills as of March 27, 2025.
Need a second?
Second.
A motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Kraft. Motion is to approve the bills for the regular meeting of March 27, 2025, as presented. Any discussion, questions, or comments on the motion? Hearing none. Roll call, Mr. Tebow.
Commissioner Trask,
Yes.
Commissioner Roberts,
Yes,
and Mr. Chairman,
Yes, motion carried, unanimous. Item 6, review a presentation of resident service report, Exhibit C in your packets. Mr. Tebow.
members of the board, I believe it was almost a year ago, that we have, approved a contract with Focus Strategies, recognizing the increasing need of our residents, to continue to live independently. We wanted to take a look at how we deliver resident services. Focus Strategy bid in on the contract. They are very well qualified. Ms. Camacho, who's here today, and will be making a presentation, spent quite a bit of time with our staff, with our residents, collecting data, and has really put together a great report. And I want to just mention 2 things before I turn it over to you, Rebecca, to make your presentation. The report is written in English, and so it's easy to understand. It has actionable items in it. It has items that we can take out and start working with. So myself, Mr. Plouffe, Mr. Sheedy, Mr. Welsh will sit down and start to put together ideas on how to better deliver our services and how to better link with the other service providers, because it's not just our service coordinators here. We have people working for Old Colony Elder Services. We have people from the Y working with us. We have people who are coming in providing services who are direct bill to Medicare, Medicaid, that kind of thing. And so in here, it shows where our weaknesses are, which is what we wanted to see, and shows that some steps we can take to become stronger. And with that, I'll turn it over to you, Rebecca.
Thank you. I've been told that this might not be the best place to be seen, but I hope this is okay audio wise. It's all right. All right. Give me a second. I'm going to share the deck that I have.
Janet, can you hear her all right?
Great.
I'm fine.
Okay.
Wonderful. Thank you, Mr. Tebow, for that introduction. Here's the agenda of our presentation today. We're going to go into introductions. I'll introduce myself a little bit more. We'll review what the methodology of the report was, how we collected the data that we collected. We'll talk a little bit about scope and program models of resident services, including what we were able to put together from the Brockton Housing Authority resident services programs. Just touch a little bit on best practices as it pertains to resident services. There's a lot more detail in the report that we're not going to be able to cover in the time that we have, but we'll touch on it. And then spend time on the key findings and the recommendations. So to start off, as Mr. Tebow said, we're from Focus Strategies. My name is Rebecca Camargo. I'm a licensed independent clinical social worker in the state of Massachusetts. I'm based here in Massachusetts. Before joining Focus Strategies, I was the director of resident services at Newton Housing Authority. I started there in 2016 and was asked to start the resident services program. So before I joined the NHA, there was no resident services program. There was just a coordinator who had left, and the board of commissioners at that time took the opportunity to develop a very clinically focused resident services program. And I did that for 7 years. When I started the program, there was just one position. When I ended, we had 3 licensed social workers, bilingual social workers, and 1 full-time BSW, in addition to 2 masters in social work interns from Boston College. So we really grew the program really big at that time. And then a part of our team was Mark Jolin. He's the senior lead consultant at Focus Strategies. What he brought to this consulting team was his expertise in overseeing organizations. He was the executive director of an organization out in Oregon called Join that provided housing and services for folks experiencing homelessness. So he really brought his organizational development knowledge to our consulting team. Mandy Goff helped us with a lot of the data collection efforts. She's a master's in social worker. She has her master's in social work rather, and so she helped us with data collection and with analyzing some of the qualitative data that we collected over the course of the project. And then Matt Lemon is a senior analytics consultant on our team, and he helped us analyze a lot of the quantitative data that we collected over the course of the project. Mr. Tebow, you already teed up the objectives of the review, but just to frame it up even further, our understanding when we responded to this RFP was you all at Brockton Housing Authority have had resident services programs for over 30 years. There has been a rich investment in resident services for a long, long time. And I would say from my position in the field, at the cutting edge of bringing services to housing programs, we've seen the field shift even more dramatically in that direction. And as I said, when I started at Newton Housing Authority in 2016, there was no resident services program at that time. So your program has a rich, rich history. It's a great achievement. And so what we understood is that we now are in the place to take the opportunity to look at resident services programs and see how can they better align to best practices that the field has produced, in more recent years. How can we take opportunities to make improvements so that resident services programs are better able to improve the quality of life of BHA residents and support residents' long-term housing stability. Over the course of conducting this review, we collected a lot of data and a lot of different types of data. So we started with what were the existing records. We looked at tenant demographic data, we looked at tenant arrears data, we looked at memorandums of understanding, we looked at budgets. If there was any existing data on service provision, we looked at that. We also did 13 stakeholder interviews. These were one-to-one 60-minute conversations with folks at the Brockton Housing Authority, with folks within the Resident Services Department, with community members, with other folks that had connections to resident services, and with residents. There's a full list of the stakeholders who we interviewed in one of the appendixes of the report. We conducted 2 focus groups. So these were 90-minute conversations with residents. We had one focus group with residents who were living in elderly disabled housing properties, and then a group with family households. So for a total of 24 residents participated in those focus groups. And then we did a resident survey. We collected 192 responses from that survey with the help of BHA staff. That survey was distributed to all public housing properties. We did a staff survey that was specific to Brockton Housing Authority staff, to resident services staff, and then we had a couple of community partners that were able to participate in that as well. And then finally, we did a review of best practices as it relates to resident services and sort of pulled out the best practices that made the most sense to present in this report, but also the most sense to connect with what we were seeing in resident services programs at Brockton Housing Authority. Just to start off, I know it was a many-page report, so I'm just picking up a little pieces here and there so that we can frame the conversation today. And one of the pieces that I want to just make sure we start off before I dive into the findings is when we think of a resident services program, what are the components that we're talking about? And in general, resident services programs, and this is the case for those at Brockton Housing Authority as well, have sort of 3 channels of work. There's the channel of crisis response. These are those situations that are unpredictable, that happen and occur. They could be related to something happens in the unit and there's a maintenance emergency and a household has to be displaced. Maybe it's that someone's behavior is concerning and it's come to a level of needing immediate attention. That channel we would consider a crisis response, and there's a role that resident services plays in that work, in addition to other community resources like police and other mental health professionals. There's another channel of work that's individualized services. So those are the examples of work where a resident might come to a resident services staff member and say, I lost my mass health coverage. Can you help me get re-enrolled? I'm not sure that I'm able to make rent this month. Do you know of any resources that can help me? I'm struggling to clean and make food in the house. Can you get me connected to some in-home services? So anything where it's a one-to-one service that's being offered, we would consider that individualized services. And then the third channel is community building. So these are the activities, events, programs that are organized and supported by resident services programs for a group of residents at a particular property. And these are really the programs that help enrich a community and help build connections and integration between neighbors. When we got into the work with Brockton Housing Authority, initially it seemed as though there were 2 primary providers of resident services across those 3 channels. That would be BAMSI and Old Colony Elder Services. But as we got to talk to stakeholders and as we got to talk to residents and learn more about Brockton Housing Authority's context, we really got to see that there are a number of different programs and entities connected to or within Brockton Housing Authority that fill or support these channels. So as you can see, BAMSI runs across all 3 channels. That is what they're contracted to do, to provide resident services, and that includes crisis response, service coordination and/or case management, and community building activities. In the properties where Old Colony Elder Services provides services, they do the same. And then there are a number of different entities that do some components of resident services or support resident services in some way. That includes the Officer in the Neighborhood program, which is a program where a Brockton police officer has residence at a BHA property. And so we kind of put that in the crisis response bucket. You guys have an FSS program. We put that in the service coordination and case management bucket. There's a vibrancy committee here, which is comprised of Brockton Housing Authority staff and resident services staff. Their sole charge is to think about how to bring more activities and events to properties across BHA. You have tenant associations, some of which have ideas about community building and want to work with resident services to increase community building efforts. You have tenant coordinators that will sometimes pass out memos and flyers related to resident services. And then you have the Dorn Davies Center, which is located in Campello, and one of the buildings in Campello that's meant to serve all senior residents of the community, but specifically residents in Campello. And then you have the YMCA, which provides after-school programming at several of the family sites. So taken all together, one of the big points that we want to make here is that when we think about resident services programs in these channels, there's a lot going on in Brockton. There's a lot going on, and all of these fall under the Director of Asset Management, who is also overseeing asset management. So this is a big body of work that we would consider sort of a mini system. And for these entities to all be effective in meeting tenant need, we would hope that they would be integrated and working together and coordinated really well. But right now, what's happening is they're operating as silos because they're not seen as all related to resident services as one complete system. Just want to take one little moment to talk about the difference between service coordination and case management. You saw here in this middle bucket that I have a slash. That's because as we got into the review process and got to know the work that providers of resident services are doing with Brockton Housing Authority, mainly BAMSI, OCES, there is a difference in approach for service models. Primarily, you have one provider that's delivering services under a service coordination model, and then another provider that is delivering service more closely related to a case management model. Unfortunately, just because of the way the slide deck is structured, I couldn't put this along a spectrum, but in reality, service coordination and case management is more a spectrum rather than two buckets. But for the purpose of explaining the difference, I have it here. It says two separate buckets. But in service coordination, generally speaking, that program model is the approach that staff might take in that model is to mainly connect residents with services that exist in the community and be a primary sort of middle person to say, oh, hey, you need in-home services. Let's connect you to that resource in the community. And that's sort of where the work typically ends. In a case management model, you would see that someone would have a lot more follow-up and monitoring of a situation that's happening that's threatening housing stability, for example. You might have someone meeting with an individual weekly to resolve any issues that are threatening housing stability. There would be sort of an active monitoring of how well is this person doing? Is their wellness declining? Is it increasing? And it's much more of an ongoing support model. There's no good or bad between these two models. It's just more of what's needed. And so we've taken the opportunity in this review to collect some information about tenant need and make some recommendations about what program model might be a better fit for Brockton Housing Authority now. Some between these two program models, one of these program models is definitely more time intensive and can be more costly, and that would be case management. It's very time intensive. It requires a lot of time. You can't serve as many people. Service coordination in general is less time intensive, and you can serve folks more broadly. A little bit on best practices here. There's really 7 areas of best practices when we think about resident services programs. It's resident engagement and feedback, data collection and monitoring, community partnerships, service coordination and or case management, like I said, community building, training and skill building, and equity. In the report, there's a lot of information on each of these best practice areas. There's 4 that I just want to briefly talk about. For Brockton Housing Authority, as we were reviewing all of the data that we collected in this review, equity and resident services, resident engagement are 2 areas where there's a lot of room for growth and alignment with best practices. Starting with resident engagement, being able to establish regular methods of collecting feedback and information from residents about what resident needs are, about what satisfaction levels are with the services that they're receiving, being able to include the resident voice in a more integrated way into how programs are developing and how they are making improvements. And then equity in this instance, when we're talking about equity, we're talking about does an individual at X property receive similar levels of services to an individual at Y property? And we're going to get into the next slide, which has a little bit of a chart where we can walk through, but this is an area I'll talk about a little bit later, but this is an area where we see there's a lot of room for growth within Brockton Housing Authority. And then there's 2 areas in sort of bright red where you'll see our recommendations have, collected a lot of recommendations around these areas. One is data collection and monitoring, being able to have resident services programs that have the capacity to collect service provision data, be able to tell you all, Brockton Housing Authority, how many people are being served year over year, what are the types of services that people are getting, where is their services intensity? Are there particular properties where there's more acuity? Are there other properties where there's different types of needs? All of that data helps inform how you adjust and improve a program year over year and over time. And it would be really, really, really important for the Brockton Housing Authority to invest in data collection and monitoring for its resident services programs. And then the second in bright red here is developing a program model that really matches the needs of residents now. So as I said before, Brockton Housing Authority has a resident services program that's been around for a long, long time. And I think if you ask anyone in maintenance, ask anyone in asset management, ask anyone in resident services who has been here for over 20 years, they will tell you that the needs of residents have changed. It has changed for Brockton Housing Authority. It has changed for housing authorities across the state. It has changed for housing authorities across the nation. There was a time when housing authorities were primarily housing individuals who were just retired. Maybe they left their house to the kids, or they moved out of their house and they wanted to move into senior housing. They had a small pension, and service coordination was a really good model for folks at that time, being able to just connect individuals to services, because folks, generally speaking, had really rich family systems, did not have a complex acute needs. And when those needs did become acute and complex, folks were going into institutionalized levels of care. Here we are 30 years later, we have a more community-based service model, meaning that folks less and less are going into nursing and assisted living at earlier ages, and they're staying in the community longer. This is our aging in place model. And folks have more complex and acute needs. So in terms of best practices, matching the service, matching the program model with the tenant need is going to be an important area for Brockton Housing Authority, so that the needs of residents are being met with the style and approach of the resident services program. This is one of the slides that I was mentioning when I was talking about the equity piece. This is the distribution of levels of services, looking specifically at the metric of staffing. There's a better image of it in the report if folks have it up, or if they have it with you. It's on page 32 if you wanted to look at it more clearly, because it was hard to get it in a clear way on the slide. But we were looking at staffing. We were looking specifically at the metric of on-site staff. So, we just wanted to pick one to be able to demonstrate how levels of services might be different from property to property. And we wanted to look at those properties that have a staff member that's actually on site most of the time, so that they're visible to people, they're accessible to people, people know them and know where to find them. For OCS, you can see they are on site at Bel Air Tower, they're on site at Kennedy Drive, they're on site at Campello, and there's a number of staff members who are on site. For BAMSI in their contract, they're required to cover all of the public housing properties, so they're spread a lot thinner. And you can see that some properties have layered levels of on-site services, so they have BAMSI staff and OCES staff, and some sites only have BAMSI staff and maybe not even a BAMSI staff on site. So this can show you very clearly that for some residents, they might, within their property, have a number of people that they can turn to connect them to services or to help resolve acute challenges and issues. And for other folks, there is a different way that they have to access services, or maybe they don't even know that there are services that they can access. This was actually one of the bigger findings of our focus groups, is that for the folks that were in our elderly disabled focus group, about half of individuals knew of resident services and had used them, and about half did not know that there were resident services that they were able to take advantage of. And in our family programs, we didn't have any focus group members that knew of resident services. And that's not necessarily a function of the performance of resident services programs as much as the coverage that is being expected of resident services providers across all of these properties. It makes sense that there's only a handful of people that are getting the services that are available, and then a wider, breadth of the population that is not able to access those services or not aware of those services because there's just not enough time and staff capacity. So these were the key takeaways from the report. The first is that there is evolving resident needs. So like I said, compared to BHA resident services programs from 30 years ago, more residents now experience complex medical and behavioral health challenges. Not only was this reported by staff and asset management and staff and resident services, but residents themselves have felt this. Residents or looking for more support for neighbors who have complex needs. We found that there was insufficient community resources. So even the most effective resident services programs, they depend on an array of community-based resources. And in the Brockton area, there are a few places where there are big gaps in community resources that resident services programs would historically really rely on. And that would be in the area of mental health. That's in the area of recovery services. That's in the area of financial assistance when folks are in a situation where they're not able to make rent, or if they have some sort of bill or something, unexpected expense. Brockton as a community doesn't have a lot of resources for being able to help folks in those situations. And then in-home service agencies are facing heavy staff turnover and an inability to retain staff. So at the moment, our understanding from the review that we conducted, at the moment, if there is someone who is looking to be connected for the first time to in-home services, they might not get someone to come in-home for a month. So, and you can imagine if someone is in need of support in the home and they have to wait a month, those challenges that they're facing, the stress level, that's all going to intensify over the course of that time where there is no services. And that's not something that a resident services program can recreate. Those are community gaps. And it's an important part of the story here of why we're seeing certain themes in resident need. We see administrative and strategic limitations. So BHA has to date not been able to create sufficient dedicated leadership and administrative capacity to develop, oversee, implement, and integrate resident services programs. That's going back to the chart that I shared where there's so many entities that are contributing in some way to resident services, and then even to providers of resident services. And there's not really clear administrative oversight to be able to integrate and coordinate all of those entities so that everyone is paddling in the same direction and meeting tenant need to the highest and best use of BHA's resources. And then that flows into fragmented resident services programs in the absence of an overarching resident services strategy and framework. Resident services providers are fairly siloed. So those providers, BAMSI, OCES, all the other providers that are listed in that chart, they sort of operate relatively independently of each other. There isn't a lot of cross coordination that's rooted in meeting the same tenant needs and having sort of a coordinated strategy to do that. So recommendations here, I actually might pause. Are there any clarifying questions from the board before I dive into recommendations?
Just one.
Yes.
You had said the family units have no, there's nobody there.
There, in the family units, there's no one on site, but BAMSI does offer coverage to those units.
We have the family self-sufficiency at Crescent Court.
Yes.
That's a family service at the family units.
My understanding is, and I can be corrected for sure, my understanding is that public housing residents make up, there's 9 folks that are in that program. And so it's not meant to serve all family residents. Folks can be referred into that program, and right now it's serving 9 individuals. But absolutely, they were in the
At least that's there. You said there was none in the families.
So this is my understanding of FSS. They're not considered an on-site resource where someone could just like if you were there at the property providing services to someone in the program, there wouldn't be someone that could walk in and say, hey, can I meet with you? You'd have to kind of be in the program. Is that right?
That's
Yeah,
correct,
right.
yes, yeah.
So I wouldn't think of them as a traditional resident services program in the way that BAMSI and OCS is, where anyone can be referred to them for any need at any time. But you're absolutely right. They do offer case management for people in their program.
What we've done, Mr. Chairman, is we've always stolen from the elderly service, resident service program to service the residents. But it's on a need basis instead of a proactive basis, having someone on the ground there working with them day in and day out, addressing the unique and individual needs of the families.
In the family programs, how long do they have to wait to get somebody?
And Janet, are you asking for the family self-sufficiency program? Or
Yes, yes.
The family self-sufficiency program is expanding now. We are bringing people into the program. So that will move along. We do have a waiting list now. I think we have a waiting list of 14 and we need 25 more people. So that would be taken care of. But the day-to-day resident service coordinator that we're talking about, it is more difficult for families. As Ms. Camacho said, there's a dearth of services to refer people to. And for families, it's even a smaller list. I mean, you have emergency, the Department of Children's Services. I mean, you could do that. You can get something through the school department if they have children who are in the school department. But there's not the same, and she's just said that the services needed for elderly isn't rich enough. I'd say it's less rich for families. That's been my experience at least. But we do need to, and I think one of the recommendations in here is to expand. There is a Ross program that we need to make efforts to get service coordinators specifically for our family developments, Hill Street, Roosevelt Heights, and Crescent Court. The state family sites are a different situation. Little less resources there.
Who runs the Ross programs?
That's a HUD program. We have a person right now who we're dealing with who has extreme needs. Mr. Welsh, who's in the room, is working with them. It's been difficult. Think of a very, very sick person, that I'll say medically sick, and you go to the hospital and they say, well, there's no rooms for you. We won't have anything for 3 or 4 months, but you're dying now. You're very, very ill right now.
Mm-hmm.
A number of the programs that we're dealing with, especially with mental health, that's the situation.
Thank you.
Rebecca, one other thing.
Yeah.
It's with the Brockton Public Schools. They have a program and they're working with housing on, people who need staff program or people who can't pay the rent. They have lawyers and stuff that they can get in touch with. And I'm not sure, do you know the name of that?
I do not. Through the Brockton Public Schools? Fred, are you aware of it?
I just can't think of it right now, but there is a program. They do help with the rent and everything else.
Right, that would be wonderful for resident services to be able to connect with, because that's definitely a big need that we've heard from families is the need for financial assistance.
They'd love somebody to come in that was turned down on the staff program. They'll show them how to get through the red tape and everything else.
Yeah. Yeah, I'm not familiar with that program.
There's a
But-
girl at the Brockton Public Schools that runs it. I can't think of her name right now, but
Yeah,
I'll get it.
that would be an amazing resource, I think, to connect to, I think BAMC in particular, so that if there are family households that come up and need service connection, that would be a program that they could connect to.
Good. She'll go to court with the people and everything.
That's amazing. That's
Yeah.
good. Need it.
And they come up with money somehow.
That's important. Very, very important, especially now as our cost of living is increasing. Okay, so diving into the recommendations here, we organized the recommendations in 3 buckets: lead, strengthen, grow. The first bucket, lead, has one major big recommendation, which is for the Housing Authority to consider hiring a BHA level director of resident services. As I said before, right now, all of the resident services programs, the oversight for those memorandums of understanding and contracts, all flow up to the director of asset management, who also oversees asset management. So being able to invest in a BHA level staff member that is coordinating and setting strategy, setting standards of practice, being able to even support coordination between providers like BAMC and OCES who are at buildings, at the same buildings, and also coordinate with asset management. There's a lot of opportunity for someone at that oversight level to be able to build capacity of having a really strong integrated resident services program that is looking across the BHA portfolio as opposed to single properties here and there. The second bucket is strengthen. So these were some of the things that we've already talked about, but the first one being ensuring that resident services programs have the tools and capacity to achieve program goals and inform quality improvement. This is really talking about making sure that there are strong mechanisms for collecting data and looking at that data and making program decisions based on that data. It's also referring to establishing strong standards of practice. So, as we have resident services that are being delivered across the portfolio, what are some of the standard, operating procedures and policies that we want all of them to be able to be in sync with? The second, developing a service delivery model that meets the needs of BHA residents, particularly those with acute behavioral health needs. So really starting from the BHA perspective, okay, with the data that was collected in this report, what is the right service delivery model, program model for resident services at this time? And how do we build and fund and invest to get to that right model? Is it a mix of service coordination and case management? Is it moving more towards case management? Is it looking at hiring in such a way that we're building the capacity of case management delivery of services, making sure that that service model is matching the fact that we are seeing residents with more and more acute behavioral health needs being housed at BHA and needing support. The third, strengthening internal practices and infrastructure across the BHA housing portfolio to align with best practices. This is elaborated more in the report, but it's just going down those best practices. And this is the work of resident services programs across the state, across the nation. Nobody is perfect, but it's aligning with those best practices and seeing year over year, how can we get closer and closer to being able to be really closely aligned with best practices. Consider reallocating resources among resident services programs to more equitably meet resident needs. This recommendation is encouraging the Brockton Housing Authority, with the resources that they have now, are there decisions that can be made to better serve residents across the portfolio more equitably? For example, are there some properties that maybe already have strong on-site OCES presence? Maybe the BAMSI coordinator might be able to be on-site somewhere else. Like that's not necessarily a decision that we're making, but we're saying, is there a way to look at how resources are allocated currently so that more people have more access to resident services, and a deeper level of services? And then the final bucket is grow, develop and implement a data-informed strategic plan for the growth of resident services at BHA. And then the second, secure and allocate additional funding to expand resident services staffing and community building programming. This grow bucket is very, future oriented in order to deepen and expand capacity of resident services programs. You need the money. And so this is about what Mr. Tebow was just referencing, looking at what is available in the field. Is it the Ross program, for example? Is it looking at creative ways to establish a 501c3 to be able to fund these for private dollars, which some housing authorities have done? Is there other community partnerships that can be leveraged to expand funding so that the program can have more capacity and expand staffing across the portfolio? So I am happy to take questions if folks, if there were anything that I didn't cover from the report that folks had questions about or wanted to share any information, I'm happy to do that now before closing out.
I have one question
Yes.
on the recommendations. I noticed I didn't put any other languages. Everything is in English. And we have a lot of different languages,
Yes.
and notices should be posted in a multitude of languages.
100% agree. Yes.
Yeah.
The in the equity bucket,
Was that up there? I didn't see it.
it's not specifically spelled out as a broad level recommendation, but it is embedded in some of the description.
Yeah.
In thinking of alignment with best practices, equity, you're absolutely right, is about, do people have similar levels of access to the program as much as it is about how do we resolve barriers so that people who are speakers of other languages can also receive services in a way that's accessible and easy and meets their needs. So that definitely falls into one of the recommendations, which is to strengthen, to improve alignment with best practices, would be to look at that. Alongside that would be to look at, are there ways to hire staff that bring language capacity? In the report, you'll see mentioned that OCES, all of their staff is bilingual, for example, and they cover 3 languages. So is there a way to be more intentional about that as there are hiring opportunities in other resident services programs?
Are you finding that cuts have already been affecting, federal level cuts are already affecting services grassroots wise?
That sounds like it's a question for.
Anecdotally, Commissioner, I heard last week, we had a job applicant that was from a social service agency who said the applicant wasn't sure that the job was going to be there in the future.
Yeah.
Anyway,
So I can answer from the Brockton Housing Authority's point of view. Everything is conjecture now. Nothing has happened.
Right.
I'll speak about something through the EPA a little later in the meeting, but nothing has happened through HUD to our programs. Fair housing is being addressed, gutted, I guess. We have our fair housing policies that the board has, regardless of whether HUD has a fair housing or a robust fair housing department. Nothing changes here on the ground. We have a policy, Mr. Chairman, that any program we start, we have to offer in multiple languages. The 3 languages are Haitian Creole, Cape Verdean Creole, and Spanish. Correct, Mr. Cliff? That's a policy that you adopted as the board. So regardless of whether it's in here, we would have to make sure everything was available that way. We we do try to hire people who are bilingual, right, Jose?
Yeah,
But I have to tell you, it seems like every time we catch up, the population that we caught up to is now simulated, they speak English, and there's a new population that we're trying to get up. Right now, it's Haitian and Cape Verdean for the most
yeah,
part.
I have a question. Especially in senior housing, where everybody living in senior housing is not necessarily a senior,
Mhm.
they have disabilities.
Mhm.
And some of those disabilities are mental. And the thing is there anything in the program set up that maybe a person has been moved into senior housing who has an issue or disability that their program can now look at and say that person may not need to live in that community to be relocated to something different?
I think that's a good point, and I'm sure that's a dynamic that a lot of people are seeing. I think that would fall into developing the right service delivery model.
Okay.
So I'll give you an example. When we were gathering the data for this report, Old Colony Elder Services, they provide on-site services, but also internal to their agency, they have a program called the Anchor Program,
Okay.
which is intensive 6-month case management where they're meeting with an individual who has complex needs like what you just said, like once a week, sometimes twice a week, working to stabilize that individual or working to see if there's another setting that's more appropriate for that individual's needs. And so that's an example of having a model that is able to be responsive to both individuals that need service coordination, that just need a referral and then they can do the rest, or they just need to be connected, all the way up to individuals who maybe need a lot more intensive support and potentially even need support moving on to a setting that is going to best meet their needs and make sure that they're safe and make sure that the community is safe.
Okay,
Yeah, so I think that would fall under that second recommendation.
okay, thank you, thank you.
All great questions. Any other questions from those on Zoom? Okay. Well, I'll just end with a thank you. There's an acknowledgement in the report, but I'll just say it while we're here in the meeting on record. Everyone that we worked with within Brockton Housing Authority, within all of the resident services programs, were so willing to talk to us, were incredibly passionate about meeting the needs of Brockton Housing Authority residents. So there was a lot of energy, a lot of support for trying to get this right. And so we would just want to extend a thank you to everyone that participated in the review process, all of the stakeholders, all of the residents, particularly all of the staff who supported the process and made it really easy for us to gather information and put together this report.
I want to add on to that. Thank you, Rebecca. The key people who worked for the Housing Authority and worked day in and day out with Rebecca are here, the Ellie Lawler, Dennis Sheedy, and Fred Welsh. So they.
When Sean Medeiros, yeah.
Oh, and Shauna Medeiros,
Yes.
I'm sorry, who could not be here today.
Yeah.
Yes. But we do, there are a number of recommendations here. You'll see, you have this as a foundation. We will be working off this to do some simple stuff that's just operating procedures. That doesn't cost the Housing Authority a lot of time or a lot of money. And then we'll be looking into the bigger, how do we get the resources across the board and to deal with our situation. You're lucky if you have 2 good residents living next to you. You're unlucky if you have 2 residents who are in need of services and they're not getting services. And then that's just, we don't want people to be lucky and unlucky. We want to have a plan.
Again, we need a motion on this, just to accept.
Oh, so move.
Second,
Motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janice Pratt. Motion is to accept the report. Any questions or discussion? Comments on the motion? Hearing roll call, Mr. Tebow?
Commissioner Trask,
yes.
Commissioner Roberts,
Yes,
and Mr. Chairman.
Yes. Motion carried, unanimous.
Thank you very much, Mr. Marjo. That
Thank
was
you.
a very, very good presentation.
Thank you.
Yeah, good to see you all. I'm gonna sneak off over here for your other business.
Item 7, acceptance of resignation of Patricia DeVoslia, Police Housing Associate. Did I say that wrong, Tim?
Nobody ever said it right.
Whatever.
We call her Patty D. That's what she goes by.
It's her,
Acceptance of resignation of Patty D.
Patty D, that's her, obviously, well, not obviously, it's her married name, so we can, she'll make fun of it also. Patty is actually retiring. Her husband has retired, and she has told us a long time ago that she was going to retire in June. Now it's come the time. She's been a great member of the rental assistance department. And a time there, she's seen the program
Not doing
evolve.
yet, though.
What's that?
Not doing yet.
And so, well, she's just giving us the notice here, so we're notifying the board as we have in practice. Thank you. Rebecca, thank you.
Thank you. I just wanted to take a minute to read her letter. Dear Mr. Tebow and Mr. Flo, the intent of this letter is to notify you of my retirement from my position of Police Housing Associate of June 6, 2025. I have enjoyed what I consider a productive and rewarding career at Brockton Housing for the past 10 years. However, I am now looking forward to my retirement and starting my next chapter. I am grateful for all the wonderful experiences I have had with the Brockton Housing Authority, from the new hires to the upper management. I have learned a lot about myself and the world around me. Through my time here, where I have also built a trusting network. Thank you for this personal growing experience. Warmest regard, Patty D. I just thought it was a nice letter.
Yeah.
It took in everybody. She said she had a wonderful time. Hate to lose her.
No, he's staying here. But her husband and she, they're happy.
We need a motion in a second.
Yeah.
Item 7.
Second,
Motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Trask. The motion is to accept with regret the resignation of Patricia D., Police Housing Associate, effective June 6, 2025. Any discussion or questions or comment on the motion? Hearing none. Roll call, Mr. Tebow?
Commissioner Trask,
yes.
Commissioner Roberts,
Yes.
Mr. Chairman.
Yes. Motion carries. Unanimous.
Okay.
Item 8. Finally here. Took a while. Appointment of procurement specialist, Exhibit E in your packets. Mr. Tebow?
Come on up.
Good afternoon.
Good afternoon.
If I could ask Mr. Fluff to speak, and then I'll say a couple words.
Thank you, Mr. Tebow, members of the board. We've been looking for a procurement person since our last one left. And we were very lucky this time to have several very good candidates apply. But Ms. Bruce won out because her experience over the years working in many different places of public procurement. And those of you who served on the board with David Texera saw that government's different. He was from the private sector, and every time Mr. Barry said, oh, we're gonna build such and such and it costs such and such, I said, cost so much. You know, we're doing public work.
Yeah.
And Ms. Bruce has that experience at the county level, at the municipal level. Now she'll get the experience of working for a housing authority, which is a completely different thing. Having both federal and state side, and it's just different. So we're looking forward to a very productive relationship.
If I could add to that, so we've been looking for a procurement person for some time. It's very important. As you know, we are a growing agency. Even as the government retracts, we're growing. The way we spend our money is more and more important. The more money we get, the more risk the government considers that we have. When we were going through this, as Mr. Flo said, we've been looking for a procurement specialist for some time. We weren't very happy with, the majority of candidates, this would go around was significantly better. When Miss Bruce came in though, and after her first interview, I felt this, and after the second interview, I was sure. We have a person here who not only knows procurement, but knows organizations and understands how they work. I noted here, do you mind if I call you Susan?
No, I don't mind at all.
Susan, that, she was the director of purchasing for the city of New Bedford. And, that's where she really wanted to retire from. But they had a residency requirement, and she lived in Plymouth, and so she, had family there and could not do that. So, thank God they had a residency requirement.
Thank you very much.
I do feel, again, that, when we bring a person in, and I think, Jose, you're finding this out the 3 weeks you're here, you become part of our organization, and hopefully it's a good place to work. And you're part of making that a good place to work. And I do believe that Susan Bruce will do that. So not only does she have the qualifications there, but I think she will be a important part of the management team here at the Brockton Housing Authority.
Thank you very much. Yes, and I look forward to being here.
Yep. And she's cum laude from Suffolk.
I am, yeah, I am.
But she did not grow up in Kampala.
Ah, well then, can we still take her?
You need a motion in a second,
Yeah.
item 8.
So move.
Second?
Split the president. Thank you.
A motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Trask. Motion is to appoint Susan Bruce of Plymouth, Mass. to the position of procurement specialist effective April 14th, 2025 at the step 1 rate of $61,819 per annum. Any discussion, questions, or comments on the motion? Hearing none. Roll call, Mr. Keeper.
Commissioner Trask,
Yes.
Commissioner Roberts,
Yes.
Mr. Chairman.
Motion carried unanimous.
Thank you very much. Thank you very much. Thank you.
Thanks for coming.
Thank you very, very.
And there's Janet Trask, is our third member there, with the
Yeah.
red.
Thank you very much.
Susan, you need this letter off. This is for you. I know we don't have to swear you in because you're already done from last week. But I brought you in so you can read this. I'll read it to you. I used to read this off by memory, and sometimes I would forget and mistake certain things. So from now on, I read this statement. This is for all new employees who transfer to different departments and promotions and people who come back to the BHA. Let me thank you for wanting to work for the Brockton Housing Authority, one of the best jobs in Brockton, in my opinion. We own 2,100 apartments in Brockton and administer over 2,500 rental assistance vouchers, assistant voucher aids. This is not an easy job. We, the Board of Commissioners and the executive team, put our residents first. They are our #1 priority. Without them, they don't need me, the board, the building, or the staff. Please remember to treat our residents with respect. We also say that anyone can have a bad day, be a little sharp or argumentative for no apparent reason. If this should happen to you, please smile and walk away. Don't argue. We can all strive to be a better person. If you can do this, you'll go far in this agency. I am very glad to meet you and welcome you to the team. The board meets here once a month in this room on many different subjects. Please feel free to attend if any of these items are of interest to you. I just wanted to read off this other. I have been reading this off now for, I think, a couple of years, maybe 10. 10 years?
You've been saying it, but I've been reading it for a couple.
And this just happened this month. And this was after the fact, Tom Tebow gave a check for $458 personal to a tenant. I wanted to thank him for that. Nice move, Tom. But more to come. Number 1. A tenant came in with no car, with cash, and was turned down, made to go to get a money order. She, as I said before, she has no car and they had no way to get there. As I said earlier, no car, both tenants are in wheelchairs. BHA removed from the bank by direct withdrawal, $428. Note that the bank had closed. Nobody can seem to realize how that money was taken out with the closed bank. Because of that, the bank charged the tenant $34 for the overdraft. And they also were paid the $428. The tenants had gone to get a ride to the Montello News to get a money order. They did. The money order was given to the woman at the front desk and has not been found yet. This was on March 3rd. Now they had to go back and put a stop payment on that money order. And also return in 7 days to pick up the money if it was to come back from Montello News. When they did pick it up, Montello News charged them $35 for the stop payment. They had to go back to Montello News and pick up the $383 that came from Tom. The whole point of this is it should have never happened. Both tenants were threatened with eviction, and they just wanted to pay their rent. And they did pay their rent on March 3rd. Somehow that got missed. If a tenant comes in and pays in cash, it must be accepted. I know a tenant at Bel Air Towers who owes $13,000 and is still living here. And she is paying a little bit extra each month. But she was not threatened with eviction. Please treat our tenants with respect. Nobody knows what happened to that missing money order. It was apparently lost here. And the extra charges on these tenants were $69. And these people, to be honest, cannot afford it. There has to be a better way to handle it. Thank you. That was for you to hear too. In other words, we have to treat the tenants with respect. They're our number one. If we don't have them, they don't need us. We have to have them. Okay, Jose? Keep it in mind. Come on up and shake our hand. We couldn't do it when we were on Zoom, but we can do it now.
Pleasure.
Welcome
Yeah.
aboard.
Thank you.
Welcome aboard.
Thank you. Jose, nice to see you again.
Hi.
And Mr. Chairman, if I can take Ms. Cruz over to personnel to do some paperwork.
Gotcha.
Thank you.
You got Jose?
He already did it last month. You
He's
voted
done.
on him last month.
No, we
Yeah,
go back to
he's done.
work.
Oh, now we can go back to work.
Yeah.
Oh, just sit
Yeah.
here and listen.
Yeah.
Or you can sit there and listen if you want.
He's running. I can't
Welcome, Jose.
Yeah, he wants to go to work.
It was nice to meet you all.
Yeah. it's nice
I look
meeting
forward to
too.
seeing you on the 14th.
Welcome aboard.
Thank you.
Item 9, award of contract. Painting and wall preparation for vacant unit. Exhibit F in your packet. Mr. Tebow?
If I could ask Mr. Christopher to speak on this, please?
Yeah,
This is a contract, this contract is for the on-call interior painting and wall prep of BHA vacant units. On February 7th, 2025, the Brockton Housing Authority advertised for qualified painting contractors for vacant BHA units for work that cannot be performed by the current staff. This work was to be awarded to 3 responsive and responsible bidders that met the qualifications set in the bid package. This is a 3-year, $150,000 contract that may be renewed at the discretion of the BHA and with a favorable vote of the Board of Commissioners for an additional 2-year period. On March 6th, 2025, the submission deadline, we received 1 bid as reflected in the bid tally sheet. The low and only responsive and responsible bidder was Bousquet Contracting at 133 Pittman Street, New Bedford, Mass. Bids were advertised in Central Register, Combis, the Enterprise. 2 companies received bid packets, and 1 bid was submitted, and that was Bousquet Contracting of New Bedford. I recommend a motion be made to award a 3-year contract in the amount of $150,000 that may be renewed at the discretion of the VHA with a favorable vote of the Board of Commissioners to Bousquet Contracting at 133 Pittman Street, New Bedford, Mass.
Okay,
We need a motion and a second. Item 8.
so move.
Item 9.
9. So move.
Second,
A motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Trask. Motion to award a 3-year contract in the amount of $150,000 that may be renewed for an additional 2 years at the discretion of the Brockton Housing Authority with a favorable vote by the Board of Commissioners to the Best Foot Contracting of New Bedford, Mass. Any questions, discussion, or comments on the motion? Just a reminder, this is the low bid, even though there's only one, still a low. Roll call, Mr. Cooper.
Commissioner Trask,
Yes.
Commissioner Roberts.
Yes.
Mr. Chairman.
Yes. Motion carries. Unanimous.
Okay.
Any?
Item 10. Review of end-of-year financial comparative, Exhibit G in your packet. Mr. Cooper?
Mr. Pages. So this is the, and boy, with this year is a little different, ending the year with the books because we have a new accountant. And the new accountant is using different accounting methods.
Different format, yeah.
Different format.
Yeah.
So, they're combining numbers in different ways. So, Michael has been really digging down to get this in. But I'll summarize it and then we'll answer any questions and Mike can tell you about how the programs are done. The programs have performed exactly as we expected. All the federal programs have made money. They're in surplus. We will be spending some of that as we move forward in the Campello job. The state programs did not make money. They lost money as expected. Same management company, same employees, same methods. It's a funding issue. I'll let Mr. Pacia speak to that funding issue because he has resolved it. And I have to give you great kudos on that, Mike. So I'll turn it over to Mike.
So the financial statements you have here reflect the activity for the entire fiscal year, January through December. They've been reviewed by our fee accountants extensively, and they've already been sent to our auditors to begin the audit. So as Tom had said, all the federal programs were in surplus. The state program this fiscal year in 2025, the surplus has been increased extensively, and that has to do with the fact of our deficit situation. So right now it's really up in the air as far as how much we're going to receive, but it could be a substantial amount of money that will at least for a couple of years bring us in a surplus situation. But again, it's basically we don't get enough money from the state to manage the programs. So an example is our per unit revenue that we receive from the state. So per unit revenue, we get $256 per unit per month through the state. That's what they send us through subsidy. But if you take the federal government, AMP1, which is a family development, we get double that. So it's quite a disparity. So
yeah. By the way, AMP1, the properties, 2/3 of the properties in there were built in the 50s. Yeah. Hillside Village and Roosevelt Heights. So they're not new places. And we're running them on about $500 something a month. State places are in worse condition because they haven't given us capital money. They're more difficult. We ended the year about $760,000 in deficit.
yeah.
They cut our income during the year. We kept our expenses within what we were budgeting, relatively within what we were budgeting. We've been speaking to them all along. They've already committed. What was the number you gave to me yesterday, Michael?
2.7 million is what they've committed in subsidy.
So they've committed 2.7. Our accountants had said, look, let us look at this again. We think they should give you a little more. We are now going back and forth with them. So they have made us whole and brought us back. We will have about a 35% reserve, positive reserve level. And we're continuing to say, look, if you want us to continue to make these places habitable, you need to give us money. And I'll give you an example. Vinny keeps very detailed records on this. Our average turnaround cost for a state unit is about $8,000. Our average rent is about $200. Divide 8,000 by 200. Your payback period is, what's that, 40 months
Yeah.
before you even got close to breaking even.
Right.
It's, the state knows this. They are not fighting us on it. In fact, they're sitting there saying, hey, we want to resolve this with you. You're not unique. New Bedford, Boston, Springfield, all the urban areas that house the lowest income people with the oldest housing stock are experiencing this. Housing authorities that don't rely on subsidy, Abington is one of them, are fine because they get every dollar they're supposed to get. We get about 60 cents on the dollar on the subsidy. So again, we're working through I'm glad to say we ended with the housing authority, the federal programs in great financial condition, and with the state and their commitment to us, it's in adequate condition, and we will continue to request additional funds for them for our vacancy preparation.
First page is great.
Yeah, I know, that second
Yeah.
page with the state stuff on there is,
Just one
quite
question.
sad, sure.
Does that $716,000 ever come back
Yes.
from the, they'll pay it at some time?
Yeah, as a matter of fact, they've already sent us 950,000 since the first of January. So
Hmm.
that covers that,
Yeah.
and you know, they'll be sending us more, so.
Great.
So, and I want to let the board know, so on a quarterly basis, right now, the quarter ends 3/31, we have to send in the books. We sent in the books last April of May 15th, we have to have it in, is
Yeah.
it 45 days?
Mhm.
After every quarter, we send it in, we say, hey, guys, there's no money here. We got no money.
Yeah.
There's no money. And they said, don't worry about it. We know.
got it.
Now,
You're gonna pull it out of your head, Tom.
but
You're
that,
hiding it there.
that's awful nerve wracking because it's a verbal, don't worry about it, we know.
Yeah.
Recently, in writing, they came back and they said, here's $2.7 million. That's going to make you whole plus. It's gonna pay for all these, the deficit, and it's gonna give you a lot more to go. So that was very, Mike and I talked and Tom on a regular basis. Boy, I hope they're good on their word here, and they have been. Yeah.
So,
Sounds good.
so I mean, the costs have pretty much, the ones that are always back every year as far as, large increases are the maintenance contract costs, the benefits. This year, legal expense was, quite substantially higher than in previous years, and that's only because we were coming out of, the COVID situation where the courts were opening up and we were, we were able to use our lawyer more often and start the process of dealing with, unpaid rents through the court system. So we expect that will start to decrease as we go through the fiscal year.
Michael,
Okay.
were you involved with the lawsuit against me?
No.
I didn't get the lawsuit.
Oh,
Is that over with or?
he did not respond, so it will, next letter will say that, it's been,
Like when he said legal expense?
oh, no.
No, this is
This
what
is
I was
on the other side.
Yeah, this is all I was referring to was.
And I want to clarify on behalf of the chairman, it's not against, the chairman, it's against the housing authority of which you're the chairman.
But it had my name.
It has your name, yes.
Name on it.
Yeah, usually they put my name on it, they put your name on it this time.
Lucky.
But the 9 Peyton Court is fine, your truck is, your car is fine.
Yeah, it's not really takes so hard.
Get bank accounts.
We need a motion in a second, item 10.
So move.
Second,
A motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Kraft. Motion is to accept the financial comparatives for the period ending December 31, 2024, and put on file. Any discussion or questions on the motion? Or comments? Hearing none. Roll call, Mr. Tebow?
Commissioner Trask,
yes.
Commissioner Roberts,
Yes.
Mr. Chairman.
Yes. Motion carries unanimous. Item 11, review of annual meeting outline of the day, Exhibit H in your packets. Mr. Tebow?
So normally, or usually, not normally, usually we bring this to you the meeting before the annual meeting. And we say, this is what, the layout of the day. What I've done this time is we're bringing it earlier because I would like the board to comment on how they would like the day laid out. So this is what we've done over the years. There's
Yeah.
probably been, some, slight changes to it. But if you'd like anything added, if you would like the rearrangement of the, events, if you would like, again, I mentioned to Commissioner Sullivan, the Pledge of Allegiance will be conducted by Tom Tebow there, and there's no reason why that can't be by, Tim Sullivan, as you usually do at your meeting. I did contact, Matthew Cunningham. He is working to get us a, singer, so it says Stephen Nascimento here, who was fabulous last year, but we're looking to have, so somebody here, but I just wanted to put it in front of you now. And if you have any recommendations today, if you want to discuss it, or if you want to bring it up at the next meeting, whatever you'd like to do.
Can we take it under advice and just look at it?
Absolutely.
Is that okay with you, Janet? You're muted, Janet.
We can digest it for next meeting.
But please,
Heard it that time.
here's the annual board meeting, so whatever we can do, we've always tried to have board members involved. You'll see your names throughout here, but if there's more involvement, that would be wonderful.
I wouldn't mind doing Pledge of Allegiance.
Okay, that's easy enough.
Item 11, Executive Director's Report.
So I did not give it to you in writing this today, because I wanted to just concentrate on, I'm sorry.
On 11, there's no vote on that or anything?
No vote unless you were taking action, there's no action.
Okay. And item 12 is Executive Director's Report.
I wanted to just concentrate on, one thing and make sure that, everybody was, on the same page where we are with Campello. So right now, what's Shawmut? What's their status, Mr. Flook? What's their their?
What their, contract.
They're our contractor. There's an official name. It'll pop up to, Mr. Flipper and I probably 10 minutes after the meeting. They are actually soliciting, bids.
What's the same company over here?
No, that's.
That's Sean.
This is Suffolk.
Oh,
Suffolk,
okay.
Suffolk. I usually say our contractor is Suffolk. It's Shawmut.
Okay.
Down there.
Sean, what's that?
Contractor at risk.
Contractor at risk, yes. So they've been with us for the entire time as we've been developing it. They are now soliciting bids from subcontractors. Once they get those bids in, they'll share them with us, and we will then start negotiating what's called a gross maximum price. The gross maximum price, they're gonna want that price to be as high as possible. We're not gonna want it to be as low as possible, but we want it to be very reasonable. If you get it too low, you get a contractor who can't perform. If the negotiations will go on, we're looking to have this gross maximum price done by the middle of April. It's an extremely important negotiation. You want to get it right. And once you have that, the contractor cannot go over that maximum price. If something happens that causes it, it's theirs. So you know your price. There can be change orders unrelated, that could not be anticipated. I don't want to tell you that they could never change. It could. Once we have that, that's when the financing becomes real. That's where the financiers say, oh, you need $68 million or 65 million or 72 million, whatever the number is. We're going to give you, and the state might say, well, we'll kick in 5 million, and the city's going to kick in $1 million, and the financiers are going to kick, the tax credits are going to be 38 million. And the bankers that we're talking to is going to be another 20 million. It all starts to come together. Commissioner Trash, you asked about Washington. The winds in Washington are blowing against us. Nothing has come down directly to us, but yesterday I contacted the special application center in Chicago, who is handling our application on the HUD side. The woman, Kathleen Stuckelmeyer, who has been wonderful, is a very capable woman. Email bounced back, I am no longer employed by HUD as of March 21st. How that's going to affect us, I don't know. There's another gentleman who's been assigned to us. I don't know who he is.
Oh, my goodness. Wow.
We had an application in for a $14 million grant with the EPA. That is one that the administration is clawing back, pulling it back. We have not been formally notified of anything, but if you listen to the news, if you listen to people who have gotten these grants, they're taking the money back. So I don't know how that will work. We have options. We are already anticipating that will happen. And we're looking to do, thank God we're working with Margaret Moran and the Cambridge Housing Authority. She's been working on this for months on, options if that happens. I think I've said several times during this, 4 or 5 year period, it's sort of a roller coaster. Things are good, 2 steps forward, 1 step back, 2 steps forward, sometimes 2 steps back. But we are moving. We are, right now, there's no reason to anticipate that we won't be hitting our deadlines of closing this summer. But there are unknowns. There's always unknowns. But they're unknowns because of what's happening in Washington. I can't give you anything specific other than the EPA. The finances, some finances have asked us, we see in your pro forma, you have an EPA grant. We're not going to count that. They've said that right up. We're not going to count it based upon what we're anticipating Washington to do. So the next 60 days will be very exciting. That's what I'm going to call it, Mr. Fluff, exciting.
That's a good way to put it. Challenging.
I wouldn't use that word myself.
Nerve-wracking. But we are pushing forward. I just wanted to give you an update. It's still, again, we're moving together forward positively. The state, I have not been in contact with them. Well, tomorrow morning we have a meeting with Mass Housing. They're the ones doing the tax credit. They're full force ahead. There's this thing called HUD Risk Share, where HUD makes sure that everything's insurable. I don't know who's going to answer the phone when we talk to them. I filled out some forms this morning to send to HUD. Who will take them? I don't know. That type of thing is a little up in the air.
Does the board get involved in any of this?
Yes, so as we move along, that gross maximum project price, you will review for approval. There'll be a number of different things, Mr. Chairman. I might be calling for special meetings that, we can't borrow any money without your authority. So Tom Tebow doesn't borrow any money. The Brockton Housing Authority does, and the Brockton Housing Authority is the board. Yes, there'll be a number of things that the board will be.
I will connect the negotiations with the bidders. That, we don't do anything with that?
No, to be quite honest with you, I've never done it before. We have attorneys working with us. We have our developers working with us. I will apprise you of the process and see if there's a role for the board.
Okay. Fair enough.
So it's unique, and I give you a long report, 6 or 7 pages, and I didn't want this to get lost in there.
We need a motion to accept that.
Sure, yeah.
So move.
We need a second, Janet. Motion is just to accept it and put on file.
A second. Thank you.
Motion has been made by Commissioner Carol Roberts, seconded by Commissioner Janet Trask. The motion is to accept the executive director's report and put on file. Any questions, discussion, or comments? Hearing none. Roll call, Mr. Tebow?
Commissioner Trask,
Yes.
Commissioner Roberts,
Yes.
Mr. Chairman.
Yes. Motion carries unanimous. Item 13, old business. Any old business? Hearing none. Item 14, new business. I have one item about the meeting in April. That I'm gonna be on Zoom on that one. Did I mention that before?
Yes, yeah, I think it's April 15th, correct? Oh, well, did we move it because you didn't want to,
I moved it to a Tuesday, it's a Tuesday.
we moved it in case no, it's not.
So, I still have it for 24th.
If we could, if,
If it stays there, I'll be on Zoom.
could we move it to the 23rd?
Same thing, I'll be on Zoom
Yes,
that
yeah.
whole week.
I could have swore we moved it to the fifth, that we moved it.
No, that's a wrap.
The RAB is the 7th.
All right, so can we do it the 23rd?
Yeah.
Commissioner Trask?
Your milk, Janet.
Because I'm just gonna look at my calendar. Hold on.
Thank you.
Tom, you had told me the 15th, I put it on. I don't know why, whether it had something to do with Taylor or not.
No, it had to do with Commissioner Sullivan concerned about the Zoom meeting not being, the remote meeting being approved. And therefore, you wanted to do it when you were gonna be in this.
Right.
in
I
town.
have it on 15 too, 2 o'clock. I just have to be there. So
Yeah.
I'm guessing that's Brockton.
So that's not, they're not doing it on the 15th.
Would you want to do it on the 23rd? Do you mind?
No, 23rd is good. But I have to be on Zoom.
Yes, that's fine. It's just the 23rd gives us a little more time to get business together to present to you. If you want a short meeting on the 15th.
That'll be a good for a day.
Okay, go
So
down.
the 23rd at 2 o'clock?
23rd at 2 o'clock.
Okay.
How about you, Cal?
I'm all set.
Cross out the 15th, Tom,
You just did.
and the 24th. Any other new business? Item 14? Here-
Not that I know of.
Item 15, adjournment. We need a motion in a second.
Oh, so move.
Second,
Motion has been made by Commissioner Carol Ruther, seconded by Commissioner Janet Pratt. The motion is to adjourn. Any questions or discussion on that? Roll call, Mr. Tebow?
Commissioner Trask,
yeah, yes.
Commissioner Roberts,
Yes.
Mr. Chairman.
Yes. Motion carried unanimous, meeting adjourned.